can you tell, you mentioned menopause around 51 average, but what if somebody says, well, I really don't want to risk having a baby? How can you be sure that they're not fertile anymore?
So as long as you're having spontaneous menstrual cycles, you probably are still ovulating. As women, we are born with a set number of eggs. That's what we have when we start our cycles after puberty. The body does select the best ones first.
It does. That's interesting.
And so we know around age 37, 38 is when it can become more challenging to become pregnant. We know as you get even older, 40, 41, 42, you can still get pregnant on your own. There is a higher risk of having a pregnancy with a chromosomal abnormality, particularly Down syndrome. Spontaneous conceptions, meaning getting pregnant out of the blue on your own, can still happen into the mid to late 40s. And so if you are still having regular periods, I would say it is still a possibility.
Or even maybe irregular periods.
Right. As long
Any
as you're
periods.
having cycles, that typically indicates that you're ovulating. Now, as we age, our ability to actually become pregnant with a pregnancy where you would stay pregnant in your late 40s or early 50s is really low, but it's not impossible.
Does that mean the mother would spontaneously lose the baby?
You have a much higher risk of miscarriage as we age and become pregnant, and so it is one where in your mid 40s to late 40s, many women might not even know. They might have irregular bleeding and have a period that they think is, oh, maybe that's a little bit heavier, and don't think anything about it. That doesn't happen very often, but it is something that is entirely possible.